Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Welcome to the Taylor Method for Pain-Free Living podcast. My name is Dr. Hudson Taylor, and today we have the honor and pleasure of having Dr. David Wong on our show. Dr. David Wong is a graduate of Loma Medical School and specializes in integrative wellness and family medicine. He helps people and assists people in achieving balance in body, mind, and spirit. And he practices in Health Integration Center in Torrance. It's a wonderful integrative facility. I myself have been there before a couple times, and let me tell you, it is fully suited to address just again the body, mind, and spirit of each person that walks through. And so it's an incredible facility. I myself have worked with Dr. Wong and have sought his advice many times. So Dr. Wong, it's a pleasure to have you on. And for all those listening, listen carefully, because there is a lot we can learn from Dr. Wong today. So Dr. Wong, let's start off with this question here. Where are you from, and what sparked your passion for helping people achieve balanced lifestyle stress management?
Well, I'm originally from Asia, and I've always been interested in terms of health. I think it's partly from my parents. Mm-hmm. I came to the United States for my college education in Massachusetts, and I completed my medical school training at Loma in California. And what's interesting is that I almost dropped out of medical school because I didn't feel that it was the environment to help people to heal and to get well. And of course, the dean at that time came to talk to me, saying that he knew that I was very discouraged in terms of the training. But what he said was that you can make changes from within, meaning that I should complete my training and then try to make changes after I've completed my training. And that was the great advice I had. Yeah. And what happens is that I did 2 years of general medicine. And that's when, again, I got dissatisfied with the conventional medicine. I felt that I couldn't see 30, 40 people a day and make any impact on their life. So I started my own practice at that time. As you know, and back in those days, we didn't have anything. The closest thing was called holistic medicine. And I had to get a lot of training in nutrition, in a different training to set up my practice. But that's the best thing that I did for myself, because I feel that I really get satisfaction in achieving and helping people to make changes, and also in terms of optimum health.
Got it. Dr. Wong, you mentioned that, look, when you first started, you just felt like you weren't making a difference. And why was that? Why did you feel that way? And, how were you, with what perspective were you looking at the patient when you just didn't feel you were you treating the symptoms rather than the cause? Was it a, Was it just standardized protocols that you didn't agree with? What was it exactly?
Yeah. Well, unfortunately, as you know, with conventional medicine, the average visit is like 15, 20 minutes at the most, right? And that's not a lot you can do in that time, especially with educating the person. And that's why doctors end up prescribing medications, treating the symptoms. But what we're trying to do is we're trying to treat the underlying cause of the condition. And then the other thing that we say is that we do not see any patients in our office. We want to see health participants because you have to participate in your health to get well. You know, you have to work together as a team in terms of achieving your goals. And I think that's a big difference of my practice compared to other medical practices.
Mm-hmm. So you really coined the term health participant, and that really set just your philosophy of ensuring, you know, it's not just me doing all the work here, and we can't just rely upon, you know, a medication or a treatment alone. You essentially, the patient has to take, or the person has to take responsibility for their health, and that's
exactly.
You
really, I think you kind of do the same thing, right? You kind of treat the person, but then they have to also achieve. I know you talk about nutrition, you talk about physical fitness, and so on. People have to do their part. If they don't do their part, they're not going to achieve wellness. That's my philosophy. Yes,
absolutely. Yeah, you know, it's like our bodies have been blessed with the incredible ability to heal, and it's like sometimes I tell the people who walk in, I say, hey, it's 50-50 here. You know, we're gonna do our best to help you, and also when you go out of the office, the way you live your life, how you live, how you sleep, how you eat, how you think, how you go about your day. That really is the majority of your healing, because, you know, people are only in our offices for, you know, 5% of the week, right?
Yes.
So it makes me kind of think, you know, Dr. Wong, your practice is fully integrated, correct? So you
exactly
have other professionals in your office. So what are the other specialties that you have in your office?
Yes, we have a naturopath that is very well trained, Dr. Deborah Macon. Mm-hmm. She actually has a PhD in neuroscience.
Oh, wow.
And then she found that she cannot do that much so-called through only the mind. So she went back to school at Bastille University to get her ND degree, Doctor of Naturopath. Mm-hmm. And even after that, she decided that she would like to learn more about Chinese medicine. So she went back to school and got her acupuncture license. Okay.
Wow.
And then we have a nutritionist that is trained in functional nutrition, which means that, again, she works with people to make changes in terms of what they're eating, the digestion, and so on. And then we have a person that does the there's just the structural work. You've heard of Rolfing Hellerwork?
Yeah,
working with
absolutely.
Yes.
Right.
Actually, a lot of them in combination with chiropractic work also. Yeah.
Yes.
And then we also do some energy healing in the office. We have some people that do energy healing. I myself do the energy healing some of the times, because as we know, there's so much powerful natural energy that's available for us, right? Mm-hmm. And that can help our body to heal, to get into balance. Yes.
Right. I think our nervous system is a powerful conductor of that as well, you know, and we're not always consciously aware of it, but it does play a big role in healing and recovery, most definitely. And so, Dr. Wong, you know, did you always have the vision to have an integrated facility?
Yes, because I realized that I can't know everything, right? So I need to work with a team of other experts. And again, what's really interesting is that when we started our office in 1978, in Torrance, we named it the Health Integration Center. At that time, integrative medicine was not even coined. In fact, the word integrative medicine was coined probably a couple of years later. Wow. So we felt we were really a pioneer in terms of that field of medicine.
Right.
We chose the term integrative medicine integrations because, again, like you said, we work with body, mind, and spirit, integrating all those components. And we also wanted to have an integrated team of experts.
Got it. So you were a real pioneer in that. And when you started that facility, did you gain any recognition for that? Did any of the medical authorities take notice of that, or leaders in the healthcare system, or the news, or what was that like when you first launched it?
We got a lot of news publicity because at that time there was nothing central like this. But we also did a lot of education. We actually held like seminars twice a week.
Oh, wow.
In the evenings that people can come and learn more about what we were doing.
Oh, wow. Twice
and
a
also
week.
to become participants. I think like you have your workshop seminars once a month.
Right. Yeah.
I think that's an excellent way for people to learn more about what you are doing so that they can understand and also to meet you. And I think that's a wonderful thing to do.
Thank you, Dr. Wong. Yeah, education is such a huge role. And I think, doing those meetings twice a week, did you host it at your facility or did you find a different place?
No, we did.
Oh, wow.
Of course, at that time, we were right next to the Torrance Memorial Hospital.
Oh, okay.
And we designed our center actually to have a place in the waiting room large enough so that we can hold maybe about 30 to 40 participants there.
Wow.
So we had the lecture. We did that for quite a few years. Because nowadays you've got a lot of different approach. You've got social media and everything.
Right.
So it's a little bit different.
Virtual. Yeah.
Virtual, exactly. And which is good also. But I think that in person also is very important. Because people get a sense of who you are,
right.
And they can ask questions also. Yes.
Totally. Dr. Wong, when you started doing those meetings, this is something new, an integrated facility, right? Did you sense that people were really starving for this kind of care? Was there a hunger for that? And did you feel you were filling a big void or a big gap?
Yes, definitely. That's why we got a lot of people coming in to listen to what we had to offer. And I think that we did that for quite a few years. And that's how we got started in our practice. Because at that time, like I said, people don't know anything about holistic medicine,
right.
Integrative medicine. Yeah, that was a good start. Like I say, it was a lot of work, but it's well worth it.
Right. Absolutely. So that kind of, it makes me think, look, not every person is aware of the balance of just body, mind, and spirit of the person as a whole. Especially in California, look, we don't live balanced lives. We're all stressed out. We're on the go from morning to night. It's a beautiful area, but not the easiest place to live as far as just the demands financially and just all that. So when people walk into your office, look, they're not aware of this. They're not balanced. They're stressed out. They're in need. So from that starting point, if someone were to come into your office and talk with you and they're in a state of distress, dis-ease, imbalance, what does that look like? What are some of the problems that you encounter? What do those imbalances look like? And feel free to dive into that from a holistic point of view and medical as well, if there are any conditions that you see regularly.
Sure. First of all, we create a space that's very calm. So whenever people come into our office, I think they'll feel the calmness there. Okay? We have chosen the colors in the office. We also create like a very friendly environment. For example, we have a lot of cork flooring, so that kind of reduce the noise. Plus, as you know, cork is very environmentally good, right?
Yes.
And we also always have flowers in our office because we like to tell people about keeping close to nature. As we all know, nature is one of the best healing for ourselves, right? Spending more time in nature. So, of course, we always have them to take some deep breath. And I think just creating an environment is helpful. And then I definitely always spend time with the person, learning about their lifestyle, how they're living, what kind of stress they're under, and then what they have done for the past, the health issues and so on. Right. And then we also talk about their goals. And then I always try to set up the way to work with them is that we want them to participate, as part of the team for the healing. Okay? Right. And then we can do testing. We can do regular laboratory testing to find out the internal system. Mm-hmm. And then we can also do other testing. For example, Dr. Macon is very big into digestive issues. Okay. Because the gut, as we all know, is really very important, right? How the gut is functioning. We hear so much about the microbiome these days. Yeah. So there's a test that we do. It's called the GI map. Mm-hmm. And it really gives a lot of information about a person's digestion, whether they're having enough digestive enzymes, whether they're getting enough probiotics, whether they have any kind of yeast infection, parasites, and so on. And then we kind of set up a program with them to try to correct these imbalances. Mm-hmm. And people feel so much better, not only in the gut, but also many times in the thinking. They can sleep much better. Right. After they have the balance. I think you should have Dr. Macon on one of your podcasts. I think she can bring in some pretty interesting information for the public. Absolutely. I would love that. So digestive issues, yeast infections, parasites, irritable and also hormones and hormonal hormones, imbalances. Here, that makes me think. I sent you a patient not too long ago who is dealing with just major hormonal issues, difficulty sleeping, difficulty working out, low energy, weird tingling sensations. You discovered that his testosterone levels could be boosted. You started to treat him, and he is like night and day. I mean, he just told me the other day, my appetite's better, my energy is better. It's like game changing, so you really helped him with that. And is that a case like that? Is that a common thing for you to see hormonal imbalances and issues with the hormones? Well, quite a few people have that, especially older people. Even though the individual you sent me was in his 30s. Yes. And of course, he's already very physically fit, right? Right. But unfortunately, his hormone level is very low. So we kind of monitor him and augmented his level. And like you say, he's feeling much better. In fact, he sent his brother in to also get evaluated. Oh, good. But we see many older people, women that are in the 50s and older going through hormonal issues, so-called menopause, right? Mm-hmm. And by balancing them with what we call bioidentical hormones, that's very similar to the body system, we're able to help them again feel much better, get rid of the hot flashes. They can sleep better, and their moods is balanced. They're not very moody. And actually, unfortunately, men don't realize that they also go through what we call andropause. By the time you're above 50s, the levels go down, so they can experience so-called fat gain. Mm-hmm. They can experience problems with the moods. They can experience, erectile dysfunction, and also sometimes even unclear thinking. So when we check them and see that they are low, we will work with them to get that into balance. And that makes a big difference for them also. Wow. So you mentioned bioidentical hormones. So, to the viewer here watching, what is a bioidentical hormone? Is that a hormone replacement therapy? Is it, what exactly is that? Yeah, we're replacing the hormones that they're lacking with what we call much more similar to what the body produces. We have to realize that the hormones, people only think of sex hormones, right? But then they are the thyroid hormones, right? Yes, right. Because it's the thyroid hormones, when it's low, then you can feel fatigue, you can lose your hair, and so on. Right. And then, of course, there's the adrenal hormones. Unfortunately, with stress, That's the first thing that the body is affected by is the adrenal hormones. In fact, the adrenal hormones often we call it a youth hormone because by the time you're 35, your levels start to go down in both men and women. And the adrenal hormones is connected to the sex hormones. Yeah.
Yes.
And then we also tend to forget that even vitamin D is really a hormone. The body produces vitamin D with the sunlight conversion. But unfortunately, again, with the way that people are using sunblock and not being outdoors, many people are lacking in vitamin D. That's often one of the hormones, or let's say vitamins that we check for people also. Yes.
Right. So this okay, the hormonal world, and this is such a deep dive here. I want to ask you a couple more questions about this. So who are these people coming into you with these hormonal imbalances? Are they male? Are they female? Are they younger, middle-aged, elderly, all of the above? Who are these people that you commonly see?
Well, mostly are older people, both men and women. Like I said, women are more cognizant about their symptoms, right? Whereas a lot of men don't realize what they're experiencing may be related to the hormones. We also have younger people. For example, in the younger female, especially, if the hormones are out of balance, they can experience so-called PMS. They can experience other symptoms. But I would say majority of these people are older.
The majority of the people.
A thyroid hormone, as you know, can affect all ages. Yeah, that's something we do see. And often we also work with them to get what we call compounded supplements by the pharmacy, because with compounded, you can target it much more to the person's need.
Got it. Dr. Wong, this is I want to ask one more question on this topic. So when people come into our clinic, they're in a lot of pain, right? I deal with people in pain all day long, and I see a lot of people with knee pain. That's something that I see quite a bit. Here's one thing I've noticed about knee pain. The patients who have the worst knee pain and the most chronic knee pain are also the patients who are dealing with a ton of stress in their life, right? They also may be dealing with weight challenges. They may be on a ton of different medications, right? And you can just see it in their face and their skin. They're inflamed, they're puffy, and they're dealing also with a lot of knee pain, and their knees are swollen. And then also I've noticed once they go through and get over or move through stressful times, their knee pain significantly improves, right? So from more of a pain perspective here, do you notice that a lot with people with hormonal imbalances? Do they tend to be more inflamed and a lot of pain? Do you deal with conditions like that?
Yes, we do. Like, I'm glad you brought up the term inflammation, because a lot of inflammation obviously can cause pain. But remember, again, inflammation can come from lifestyle, a lot of stress, right? They also can come from foods. There's certain foods that definitely can cause more inflammation. That's why people, if they can shift to more what we call plant-based diet, they would do much better. Because unfortunately, a lot of the animal protein can cause more inflammation for them. Yeah. And then we have to remember to remind people about hydration. I think you probably talk a lot about that, right?
Right.
Because as we know, the joints need lubrication.
Yes.
And you really can't go by your sense of thirst, because by the time you're thirsty, it means that you're already dehydrated.
Right.
And this is very common, especially with the older folks. They don't realize that sometimes when they feel dizzy, sometimes when they don't feel so good, it's due to the hydration.
Got it. So sometimes, Dr. Wong, I have patients who come in and they're dealing with painful autoimmune conditions like rheumatoid arthritis, systemic lupus, thyroid conditions that cause their joints to feel so achy and so painful. So on that note, how do you address someone with, say, a painful autoimmune condition like rheumatoid arthritis? Have you seen those clients before? Is this something that you deal with?
Yes. With the arthritic people, making changes in the diet can make a difference. For example, they really need to watch the sugar intake and then the salt intake, because those foods can cause much more inflammation. Okay. Right. We also work with them in terms of the supplements. The certain supplements, as we know, that can take down the inflammation. And then the other very good so-called, it's a medicine, but it's very low dose. I'm not sure whether you've heard of low dose naltrexone, LDN. I'll tell you, that has made such a big difference in people that low dose naltrexone. There's a local pharmacist, Dr. Barras, that's been working with LDN for many years. He's really an expert on that condition. And I've worked closely with him in terms of prescribing LDN. And this has made a big difference in people that are suffering from autoimmune condition, arthritic condition, and so on. Yeah, that's a great topic that you would be good to bring to your audience.
Yes, definitely. So dietary changes, lifestyle, stress. You mentioned supplementation, and then the low dose naltrexone, and of course, you have an acupuncturist / naturopathic doctor right next door. How about the IV therapies, intravenous therapies? Have you noticed any success with intravenous therapies for pain and inflammation?
I would say somewhat, because with the inflammation, for the IV therapy, we would be giving like high dose of vitamin C, which can cut down the inflammation. And then we can also add glutathione to the IV therapy, because as you know, glutathione is a very powerful antioxidant. Right. And the benefit of the intravenous therapy is that it absorbs into the tissues, doesn't have to go through the gut and the digestion and so on. It's a much faster kind of approach. Yes. Much faster. Incredible.
Dr. Wong, there's so much that we can dive into here. But I wanted to ask you, where do you see the future of integrative medicine and this holistic approach? Is it expanding, growing all the more? Any thoughts on just the future of this kind of medicine?
Yes, I think definitely it's growing. I think that people are demanding or wanting it, right? Because people are tired of just taking medication to treat the symptoms. I think the internet has really gotten a lot more information out to the people. And that's why even in the world of integrative medicine, you hear about functional medicine, right? You hear about lifestyle medicine. I think they're all kind of related, complementary medicine. I think that integrative medicine really should be working together with conventional medicine. We can't kind of ignore the use of sometimes medication and so on. Sometimes it is necessary to take care of for example, if you have infection, obviously you need some antibiotics, right? But then you can learn how to prevent further infections by taking so-called care of your gut, probiotics and all the other things. Right. So I think it's a balance again, and definitely integrative medicine, I think it's becoming much more popular. And I'm just so happy that I got a start in this medical field, because I think if I were doing the traditional or conventional medicine, definitely I would have been burnt out. But in terms of what I'm doing, I really enjoy what I'm doing. So that's why I'm continuing to practice.
Excellent. Well, I can sense and feel just the passion and the enjoyment that you bring to each person who walks in. And again, I've been to your facility. It is a remarkable place, and I just pray the greatest success for you in the days ahead and now. And any patient who needs care regarding just their hormones and their gut and their stress, and I'm going to keep sending them your way, Doc. I appreciate your expertise, and so I hope you all enjoyed the show today. Again, if you're dealing with any sort of these stresses, imbalances, conditions, please reach out to Dr. Wong's facility. and they're fully equipped to help you participate in just taking ownership of your health and achieving a balanced lifestyle. Dr. Wong, what is the best way for people to reach your facility? How can they get a hold of you?
Sure. They can look up our website, which is healthintegration.center. And then, of course, they can look us up in Torrance. We're located in the Madrona Medical Building, right across near Costco there. Not Costco, I'm sorry, the Target. Yes.
Okay.
And then they can call the office too.
Healthintegration.center. Type that in, and they're located in Torrance. And you can also call the office. What is the best? Do you have, by any chance, on top of the head, number? What's the best number they can reach?
Sure.
Yeah.
Sure. Our office number is 310-326-8625.
310-326-8625. Your front desk will take care of the rest, correct?
Yes. And
Okay.
I'm happy to questions if people have them also.
Excellent. Excellent, Dr. Wong. Is there anything else, Dr. Wong, that you would like to say or bring up to close off the show?
No, thank you so much for having me on your podcast.
Of course.
And like I say, I have known your dad. I've met him, known the practice, and I think you guys provide very valuable service. Not only the body part, I think you do quite a bit with the neuro training also. And I think that's so important for people. Yes. Mm-hmm. Again, thank you. And I'd love to help anybody that would like to come to our office.
Thank you so much, Dr. Wong. I really appreciate your time on the show. We will be in touch, most definitely. And I'll have to come by again. And we'll have to just definitely, meet up, keep staying in touch, because there are a lot of people in need. So I really appreciate you, Dr. Wong.
Thank you, Dr. Hudson.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.